Hello, and welcome to the first in a three-part series of parenting webinars, A Whole New World, Parenting During a Pandemic, brought to you by the Hemophilia Federation of America's Families Program. I'm Carrie Koenig, Program Director at HFA. Also on the line, we have Ann Lewak, VP of Education at HFA, and Dr. Juliana Bloom, licensed psychologist and pediatric neuropsychologist. Tonight's webinar will focus on parenting children ages newborn through preschool. Just a few helpful housekeeping hints before we get started. We have allotted approximately 1 hour for tonight's webinar. We certainly welcome and request audience participation and engagement. However, your audio will be muted for the duration of the webinar presentation by our system, as it helps eliminate background noise. We will upgrade everyone at the end of the presentation so that the interaction can be more engaging and can take place. We look forward to your participation, and if you'd like to ask a question during the presentation, please utilize the chat tool on the bottom right of your control panel. We will then pass your questions on to Dr. Bloom. We will be answering most questions at the end of the presentation. All of the parenting webinars will be recorded and posted on HFA's YouTube channel for future reference. We would like to take a moment to thank Takeda, CVS Health, Novo Nordisk, and Genentech for funding our Families program. Without their generous donations, this webinar would not be possible.
Slide advance.
Oh, I'm sorry, yes, thank you.
Juliana, can you advance our sponsor slide?
There we go.
There we go.
Thanks so much, I appreciate that. Sorry.
Today's presentation is A Whole New World, Parenting in a Pandemic. We have an extremely knowledgeable speaker, Dr. Juliana Bloom, who is based in Orlando, Florida. Dr. Bloom is a licensed psychologist and pediatric neuropsychologist. She received her BA summa cum laude from Emory University and her Master's of Education and doctoral degrees from the University of Georgia. While at the University of Georgia, she conducted clinical research on the neurobiological basis of dyslexia and ADHD. Dr. Bloom completed her internship and postdoctoral fellowship at the Children's Hospital of Philadelphia, where she worked with children and adolescents with complex medical and neurological illnesses, including stroke, epilepsy, brain tumors, cancer, blood disorders, and traumatic brain injury, among others. Dr. Bloom's area of clinical interests include dyslexia, ADHD, neuropsychological outcome, and school reentry following acquired brain injury and medical illness, and medical trauma stress in patients and families. She is the author of 7 peer-reviewed journal articles, 6 invited book chapters, and more than 40 conference presentations. She is a member of the American Psychological Association and the International Neuropsychological Association. She loves spending her free time with her husband and 2 children. And again, we just want to remind you that as well as this webinar is for educational purposes only and is not intended to be construed as medical advice or the official opinion or position of HFA, the staff, its board of directors, attendees are strongly encouraged to discuss their own medical treatment with their healthcare providers. And with that, we can get started with our welcome to Dr. Bloom, and I'll let you take it from here.
Thank you so much. I really appreciate all of you guys having me. It's an honor to be able to present to you guys. I am here as a psychologist and a neuropsychologist. Like they said, I am not a medical doctor, so I do have a PhD, not an MD, so I'm not able to give any medical advice. But I'm coming at this from a perspective of somebody who has worked in children's hospitals, who has my own 2 children, and one of my children does have a chronic illness. So I understand a bit of where parents are coming from, and I want to talk a little bit about parenting specifically and how that has to change during a pandemic. So if you guys are anything like me, you're feeling a little bit like this. Day 1, I felt like Mary Poppins. We're gonna do this. We're gonna do homeschool. It's gonna be fantastic. We're gonna keep you guys home. We're gonna keep you safe. I'm gonna work the whole time. We're gonna have a schedule. You know, some people pulled out those color-coded things. I knew I never had that in me. But a lot of people, you know, see all this. This is gonna be fun. This is gonna be great. We can do cooking together. That's really math and science. Okay, so it gets more challenging as time goes along, and especially as you realize that you have to do the dishes to go along with all of this cooking math activity, and maybe your conference call starts right when something goes into the oven, you know, these kinds of things. It is definitely a challenge right now to be a parent, to be a working parent, and of course, if you have an essential worker in your home, the challenges are even more so. You add a child with a chronic illness onto that, and we all start feeling like Miss Hannigan by about a little ways into it. So I want to talk a little bit about why this is so hard. Like many people, I look to sometimes if there's a life event, something, you know, a major historical event that's happening that I'm living through, you know, I will ask people who I know who are older than I am. So when I asked my mother, she said, I've never lived through this. I don't have any advice for you. You know, so this is something that has not happened in about 102 years, and not on this level. And it is very, so we don't have people to look to, very few, who remember what it was like, and certainly no one who was parenting during that time. But this has been done in human history before. There have been plagues, there have been pandemics, and people have taken into their homes to quarantine. And I don't know if anybody wrote books on how difficult that was. Probably not, because they were too busy parenting during that time. So the people who are writing the books are the people who are home alone. But the good part of that is that the whole world is experiencing this at the same time. And so in that sense, we can help each other. But there's not that sense of, there's no pathway, there's no perspective. We have no perspective for what this is like. Do you know 90% of kids are out of school right now? It's a pretty amazing statistic. We have 90% of children in the world who are not attending school. As this is happening, these kids are experiencing a huge loss of their world, their education, their friends, their coaches, their teachers, and particularly with the age group that we're going to be talking about, toddlers and preschoolers. I mean, we can talk about infants too, but I think infants are probably very happy to be snuggled with their parents right now. That's their primary developmental need, is to form an attachment to their parents. And I'm sure that what's more challenging is parenting while trying to hold an infant, not having those extra set of hands around. But I don't think the infants are particularly upset. I think the toddlers and the preschoolers, though, do feel a loss with what they're going through right now, what they're missing. And then parents who normally help the toddlers are stretched so far beyond their own capacity of what is normal. So even if you are a stay-at-home parent, you've lost your support network. You can't go out and have those mom groups or that music class or that, you know, toddler play class. It's even difficult to go to the park and the playground because, you know, how are you supposed to tell a toddler or preschooler not to touch the equipment or not to play with other kids that they see there? You know, the world has really shrunk, and you don't have that support network as a parent. So whereas the people who are single and the people who are retired or their kids are out of the house, I think they are feeling bored. And I think that many of us who are parents, particularly if you are a working parent who's trying to also homeschool, who's now there's so many more dishes than there ever could have imagined that there were, that you are stretched far beyond your capacity. So my family and I were taking the dog for a walk the other day, and we got into a conversation from about 20 feet away with a woman who owned the house, and she was saying how bored she is. And my husband and I looked at each other and went, okay, well, but we can't help each other. People who have that more time can't help each other because, you know, those of us who have toddlers and preschoolers, we're in maximum work mode. And so this is very hard. So my point in all this is to say this is an extremely hard time. And if you feel like you are stretched beyond your own capacity, you are not alone. There is a reason it takes a village to raise a child, and your village just disappeared. So one of the things that a lot of psychologists are saying is to understand that and to give yourself some compassion. This is not humanly possible. You can't do all of these things. Working, parenting, and teaching are 3 different jobs, and they take 3 different people to do them, and you cannot do them at the same time. It's not your fault as an individual. You could, if you were more organized, this wouldn't be easier. This is about, it's just too much for any human to do. So at some point, you're going to have to let some of this go. And when you have to pick between the things, my advice is to pick being connected to your child, to your spouse, and not as much worrying about the academics, because the academics are, that's not what's really going to matter a year from now. What's going to matter is the emotions of it, and I'll explain that a little bit more. So when you have to pick, choose connection. If you're feeling stressed, we're going to have to lower our expectations a little bit, because you're being asked to do too much. And so hopefully knowing that you're not alone in that will be something that is helpful to hear. Okay, so let's talk about what we know about the emotional effects of a pandemic. The truth is that there's not a lot that we know. There is emerging evidence that is coming out, some from China. There is some evidence from before where they did studies of people who were quarantined, but not when the whole society was quarantined at one time. These are individuals who were quarantined because they had some sort of contagious disease and they had to be quarantined for a period of time. What we know is that it's linked with post-traumatic stress, symptoms, confusion, and anger. There's a lot of fear. There can be a lot of fear for yourself. There can be a lot of fear for your loved ones, especially essential workers and people who are in a vulnerable population. There's an incredible amount of economic and financial worry right now, where a lot of people's financial situations have changed and they're not sure how they're going to make it through the next month or two, or what, even if they can make it through the next month or two, what's going to happen in a year. Homeschooling adds a whole other stress. I would say that the technological aspects of it almost put me over the edge in the first 2 weeks. But and then at this point, because we're about 2 months into it, it's just that it's been dragging on and on and on. So, you know, we kind of got the hang of it. We were in a groove for a while. It was okay. And then just, this is not how people are supposed to learn. Learning happens essentially through social connectedness. There's a reason that we have teachers. There's a reason that we have classrooms. And a parent teaching a child is just never going to have this, they're never going to capture the kid's attention in the same way, even if they're a wonderful parent and a wonderful teacher, even if they're teachers in their own right. But it's the nature of that relationship. The parent-child relationship is just a different relationship than the teacher-child relationship. And, you know, the parents are there to pick you up and catch you when you fall. The teachers are there to push you. And so that homeschooling creates that dichotomy where it's really not happening what they need. At this point in society, the kids really need more. They're needing more than they did before this all began. They have a lot of fears. They have a lot of questions. They need more from us educationally, and they need us to be their playmates. So there's an incredible amount that is happening that is demanding onto parents. And it's important to note that's not something that is normal to experience. We're getting some emerging research out from China. About a quarter of children in China who are under lockdown showed symptoms of traumatic stress. That's a pretty huge number. And then there was another, so that is about a quarter of the children showed those symptoms. Some of them even met criteria for depression, whereas the normal amount of kids who would meet criteria for depression would be about 2 to 3%. Now, I will say it's important to know that in China, if there was a family member who tested positive, that family member was removed from the home and was put into a quarantine facility. And so sometimes that meant children being separated from their parents. And when that happened, that was the thing that really caused more of the mental health difficulties when you broke it down, when you broke that study down by the data. So I don't think that we're going to be looking at 25% here. But I think that certainly we're going to be looking at a huge increase in traumatic stress symptoms, which I'll talk about what that is in a second, anxiety and depressive symptoms. And a lot of the symptoms that they saw were clinginess, distraction, irritability, and this wouldn't apply as much for toddlers. This is more for older kids. Fear of asking questions about the epidemic, meaning and when you start avoiding things, that's a major sign of anxiety. So this is what one of my friend's sons did. He had to do, his assignment for kindergarten was to do one of those poems, I forget what they're called, where you have the letters and then, you write a word to describe what every letter is. So he did corona, didn't spell it correctly, but that's okay. So he writes, corona is the worst. Oh, so many people are sick. R, red is the color of it. think he's got that down. And no, and A, awful. So our friend, he really just kind of summed up how a lot of kids are feeling about it. So this is a 6-year-old kid. So he's able to, express how he's feeling about this pretty well, as I'm sure many of your kids are. I want us to talk specifically about your population. I think because of the need for treatments, I know that was a worry for a lot of people. My understanding is from Carrie and Ann that has been okay in terms of having access to those medical treatments, but those medical treatments are really expensive. And so the financial worry, if you lose your job and you lose your health insurance, then how are we gonna be able to continue that treatment ongoing? In terms of understanding how this might be interacting with hemophilia itself, how COVID and the two might interact, there's no evidence right now that it's a big worry, aside from those who are in that inhibitor subset. However, it's always more complicated when you have a child with hemophilia, or if you yourself have it and you have to be hospitalized. It's not something that every doctor understands maybe as well as they should. There has to be a lot of advocacy in the hospital, and in order to make sure that things are taken care of as they should be taken care of. And then, concern about if you have to be separated. Sometimes people are not allowed in. So that's I think there's just a lot of worry, and there's a lot of unknown. And when you have things that are just part of the unknown, and you have that in your back of your mind, I really don't want to go to the emergency room right now. I really don't want to be hospitalized right now. I don't want my kid to go to the emergency room or be hospitalized right now. That is always something that is, my point is, when you have a chronic illness, there is always going to be just another layer that you're worrying about beyond what everybody else is worrying about. And that, weighs heavy on your mind and creates another stress. I'm going to talk a little bit about some ways to think about what it is that we're dealing with. And the reason that I'm going to talk about it is because it will kind of help as you see the symptoms that your kids are experiencing. So one of the things to realize that this is grief. That's one way to conceptualize this. So I think that if you are not an essential worker, if you have not lost someone directly, this is still grief. Because the world has changed. We know it has. You can feel it. I don't know about you guys, but that first week, I could feel it in the air. There was an energy that was there. And now they're just that's kind of gone down to like a weariness, I feel like. Just as things were different, going to the airport is always different every time you go after 9/11. That's a completely different experience. Our world is going to be different from this point on. And there's a loss of normalcy. There's a fear of the economics. There's a loss of connection with your support network. And we're grieving. And then we're grieving about what the future, anticipatory grief. We don't know exactly what the future is going to hold. And we can't see this, but there's a part of us deep down in our brain where something as bad is happening, and you lose that sense of safety. So it is very normal to experience some of these 5 stages of grief. So if you guys don't know what they are, they're denial, anger, bargaining, depression, and acceptance. So in my house, I have seen some signs of depression over the past few weeks. We have, for my kids, as they've gone down. There's just kind of a lower energy than I would expect them to have. And I think that one thing that's important to realize, though, is that this is something that you can move around between these stages. These stages aren't a path that you walk down. It's more like hopscotch. You're bouncing around between them, and it's totally normal to have, a sense of acceptance one minute, and then the next day you might be back into denial or bargaining or whatever the case may be, and you might be feeling really angry. So, that's one way to conceptualize what's happening, and I think it's probably a good way to conceptualize it if you're just kind of a typical person who's meeting the challenges of this pandemic. I think that if you have someone in your family who you've lost because of this, someone close to you that you've loved because of this, or you're on the front lines dealing with it every day and going out and having that fear, if you are, working in a grocery store, or if you are a first responder or working in a hospital, those people who are seeing, well, particularly if you're in a hospital and you're seeing the disease and what it's doing to people day in, day out, I think that that is a recipe that is ripe for post-traumatic stress. So what happens when you have that kind of stress is there's a part of your brain deep inside called the amygdala. I'm gonna see if I can you see my little cursor? It's deep down in there, okay? And that is the part of your brain that gets activated when there is fight or flight. So, you know, a zillion years ago when they saw a saber-toothed tiger coming your way, that part of your brain lights up and it releases a huge amount of cortisol and adrenaline. It shuts down your digestive system. It shuts down your sleep system. And it really does a lot to your hormones to make your body breathe fast, pump oxygen and blood to your muscles to make them work hard. And that is a very, very good thing for us to have in the short term. You really need to have that fight or flight response happening when things are short term. But the problem is that at some point that adrenaline wears off, and it can, or even more difficult, sometimes it just doesn't wear off. So a lot of people, for the first couple of weeks, they had a lot of sleep problems. And it's because your body was very much on edge and you were really you're washing your hands all the time, you're wiping down things. So a little bit of anxiety, this is where having a little bit of anxiety is useful. It keeps you protected, it keeps you safe. But when you have anxiety on the chronic, like when you have it, you know, for months and months and months and months, that is really hard for your body and for your mind. It takes a toll on your body and it takes a toll on your mind. So the amygdala right there with that little dot, right next to it is this area called the hippocampus. And that's responsible for taking memories and encoding them down. So that's a major part of your learning brain. So what happens is that when you have got a lot of adrenaline going on, it actually interferes with your learning. So that is the reason biologically why I'm saying that we want to prioritize connection and calming over the academics at this point. Because if you don't get yourself into, if you don't get your young child into a place where they feel calm, then they are not going to be able to do any learning. So that's where the comfort, connection, I mean just snuggling, whatever it is that you need to do to make your child feel safe is very important because they realize that there's something going on. The other part is this part up in the front of the brain. It's called the prefrontal cortex. That's the part of your brain that is really undeveloped when you're born and grows an incredible amount through your lifespan. It keeps growing actually into your early 20s, but a lot of that growth is happening during those toddler and preschool years. There's a spurt during that time, and then again during the teenage years. This is the part of your brain that is like the controller, okay? And it's like the executive, and it can say, okay, this is how I'm going to react to the situation that's coming to me. This is how I'm gonna plan. This is how I'm gonna organize. Well, guess what? It has very strong connections to the amygdala, but in the sense of like a magnet. When one shuts on, the other shuts off. So when the amygdala lights up, that frontal lobe is turning off. And so that can also explain why you're going to see some challenges with your kids that you might not completely see right now, but you weren't used to seeing before. Okay, so our hormones are rushing through our body. Okay, this is for the adults, but the kids are picking up on this too. They have had a big change, and this leads to that. They tell us to fight or to flee, and we can't do either. We're being called up to stay at home and to wash our hands and to stay calm. And that is not really what humans are designed to do in a crisis situation. Just so you know, a lot of adults end up with some of these symptoms just from those hormones released, just from that huge rush of hormone release. Lightheadedness, headaches, GI, back injury, pain, weakness, even some shortness of breath, and heart disease. That's just from chronic anxiety. That's just from that hormone release deep down in your brain. You can also see from chronic anxiety distractibility, difficulty sleeping, and kind of restlessness. One of the great ironies of life is that when a toddler or preschooler becomes anxious, they usually also become hyperactive. So, you know, that makes it even more challenging, you know, than it would be if they become physically calmer, because hyperactivity is hard enough for you to deal with. So what can happen to both adults and to kids is something called traumatic stress. So the symptoms of traumatic stress are re-experiencing Avoidance, so re-experiencing is like having dreams about it, something that's happened to you. Avoidance is not wanting to talk about or actively avoid things that remind you of the difficult event. And hyperarousal are things like difficulty sleeping, difficulty eating, shortness of breath. And if those occur more than 1 month after exposure to a traumatic event, that becomes post-traumatic stress disorder. Acute stress disorder is having those symptoms for the first 30 days. So in the first month, most everybody was having some of those symptoms of acute stress disorder because so much had changed, there was so much worry, and it was a traumatic event. When you have, if it's still going on at this point, if there's not a new event, then we might be looking at something that is post-traumatic stress, or even, it doesn't have to be diagnosable necessarily, but one way to think about it is you can have those symptoms at a subclinical level. So you don't necessarily need to be diagnosed, but you're still having some of those symptoms, not enough to really interfere in your life, but some of that is normal, particularly when you have a traumatic event that's ongoing, like this one, then it's normal to have some of those symptoms. When you want to get help, or when you want to get help for your kids, is when it's interfering in your functioning, when it's interfering in your life. That's when you want to deal with it, because there's really good psychological treatments available for PTSD and similar. Also, just from my experience in the hospital, when I worked in a hospital setting, it's incredibly common to actually have symptoms of PTSD from your child's medical experiences. So it doesn't have to be something that happens to you, it can happen to your child. And so that's the way that we actually conceptualized, that was the best way of putting a picture together of what was happening to the parents. And so much of what you do in a hospital setting is trying to also provide that support for the parents. Because, they're with the kid day in, day out. And to understand that is very, very important. Okay, so we talked a little bit about the survival brain versus the learning brain. This is another slide that kind of shows you the amygdala here. That's the fight or fight part. The hippocampus, this is one of the learning parts of the brain, and see how it connects right up to that prefrontal cortex. So when the amygdala is firing, it kind of shuts down those two areas. So that will explain to you a little bit about why you might be seeing some of the difficulties that you can be seeing at home. Another way to conceptualize this is something that's been studied in psychology a lot, called an ACE, an adverse childhood event. So it's a frequent, chronic, uncontrolled, toxic stressor. So there are a lot of different ones: poverty, racism, divorce, health, anything like that can be considered an ACE. ACEs can have major long-term effects on our learning, our social emotional skills, and our health. So there's been some interesting studies that kids who have 4 or more ACEs during their childhood are much more likely to have heart disease as adults, irrespective of habits. So the diet and exercise were not as important as actually having all of those adverse childhood events. So if this could be an ACE for many kids, what's happening in an adverse childhood event. It really depends on the specific situation and how we're coping with it. Because some stress is good. It's good to have some stresses in your life. It's good to overcome them, even for young children, because it teaches resilience and coping responses, and that's something we want our kids to learn, and especially when that's facilitated by a caregiver. So we'll talk a little bit about how you can take this and turn it from an ACE for your child to turning it into an opportunity for them to become more emotionally resilient, which is, I know, what we're all hoping for. So there's a lot of things that can take an ACE and make it to be less adverse for your child. So nutrition, exercise, lowering stressors, and having good, strong relationships. The good news is that children in general really just need to have one strong relationship to a primary caregiver. And so for those of you who are on your own, or your spouse is working and you have to be separated, or a single parents, whatever the case might be, we know from the research that having one secure attachment to an adult is really all that a child needs. One thing I can say is that it's important, even when you are feeling in that very stressed place, to have that connection with your child every day. But you don't need to do nearly as much of it as you think. 15 minutes a day where you are really focused on your child and you are doing something that is child-led. You're not trying to teach, you're not trying to discipline, you're just spending time with your child and something that your child leads for 15 minutes. That is actually enough to build up that connection. And that will reduce a lot of behavior problems too. So one thing that you want to do is to focus on being warm and supportive in your words to your child, which I know can be difficult with the amount of patience people are having at the, we're all out of patience. Try to make eye contact and respond to their words and gestures as much as you can. Being responsive is really what they need. That will help them build, and we're going to talk about specifics to build up some resilience skills. And then also focus a little bit on what can your child control. Giving them some ownership and control can really be helpful. So for this age group, toddlers, preschoolers, we are having spaghetti for dinner tonight. This is not a choice. What plate would you like it on? That is a choice that you can make. Would you like milk or water with it? That's a choice you can make. So, but what's for dinner is not up for debate, unless you want to go cook yourself. Kids need to have a coach to help them through this. So this is part of where, this is another burden being placed on parents right now. But it really, if we do this, it can really lead to some great impact. They need you more than ever for that perspective and that modeling. So it is okay to not have it together in front of your child right now. In fact, it is probably healthy. What is really important is for you to pay attention to your own emotions and to show them how you cope with them, because they're going to look to you as a model for how to do that. So, for example, if you are just feeling really down, or if you're feeling really stressed, if you're feeling really overwhelmed, it is absolutely okay to say to your child, Mommy is feeling really overwhelmed right now. I'm feeling really worried because I have to do this and I have to do this. And I'm just going to take a few minutes and I'm going to sit on the couch and I'm just going to breathe in and out for a little while so I can help my body calm down. That is a perfect thing to do in front of your toddler or preschooler, because it will teach them to do that themselves. And it will teach them to be aware of the emotions that they're having. What it shows them is my parent is aware of her emotions. And when he or she has a tough time, this is what they do. And that's very important, because otherwise those emotions just go inside and end up controlling our reactions, whether we realize that they're there or not. So this is beyond, so this pandemic really requires skills above and beyond the normal, take a bath, have some time to yourself, don't worry about the dishes. My favorite parenting advice was, don't worry about the dishes. Well, if I don't worry about them, they're just going to be there tomorrow. So that one never worked for me. This is time to pay attention to your own emotions and to use some coping strategies, and that will help your kids do the same thing, because that's what they need to learn how to do right now. So that's how we turn this from an adverse childhood event into something that builds some resiliency for kids. Okay, so kids this age, they often lack insight into their own feelings. What I mean is they have huge emotions, okay? They have absolutely gigantic emotions. That's normal for this age. They have a desire to control those emotions, but they don't necessarily know that there's a link between, they don't know how to label their emotion. So if they hate spaghetti and spaghetti is what's for dinner tonight, and that's not what they wanted chicken nuggets, and they feel angry. So that is the thing to do, is to label that for them. I can tell you're feeling really angry about this. And then, you can say, when I'm angry, I take some deep breaths. And let's make a plan for tomorrow. We can think about what we might want to have. If you have a suggestion for dinner, we can talk about it. Or would you like some strawberries on the side? Because I know you really like strawberries and I've got some good ones. So labeling those feelings. It seems like you feel really sad right now. It seems like you feel really frustrated right now. I'm guessing that you're worried right now. Are you feeling worried about something? Just building that into your language as you're talking with your kids is really the first step. That labeling of the emotions is the first step. Kids this age also can't communicate their feelings well necessarily. They're not aware of, they don't have that insight into what emotion am I feeling and how can I communicate that. They just act. So try to think about what that behavior is telling you. They're not going to tell you, well, I'm feeling really frustrated that I can't see my friends and I miss my teachers. They're going to decide that the bath water is the wrong temperature and they're going to have a tantrum about that. When what they're really upset about is the fact that they miss their classmates and their teachers. And that mommy has to work, daddy has to work, and I don't get someone's attention. So think of that behavior as a communication. What you're gonna see is a lot of fussiness. You're gonna see a lot of withdrawal. You're gonna see a lot of regression. So those are the kinds of behaviors that let you know that your kid's not doing okay. And if that's the case, you will not be alone. That is, I think, what most every child is experiencing, at least some of that right now. I think that's normal. And maybe use that as an opportunity to talk about what the feelings really are. So the problem is that these regressions are happening at a time when the parents are just overwhelmed already. The last thing they need is for their child to stop being potty trained. The last thing they need is for their child to refuse to eat everything or to not be able to sleep through the night. But that is probably what's happening. That's probably what you're seeing. And it really happens from that amygdala being in overdrive. So, you know, I have a former graduate student who reached out to me because she is about to give birth to her second child. And of course, at the beginning of this, her older child, who's 3, decided that she could not sleep alone. And we were talking about this, and she was saying, I'm setting all these limits. And I said, I normally am very, you know, limits are good, routines are good, structure is good. My point to her was, this is an adverse childhood event. And this is a major stress that has happened to your child, even though your child can't necessarily articulate exactly what's going on. Your child's world just became very, very small. There's a general fear in the air. She's lost her classroom. She's lost her friends. She's lost her routine. And she is, you know, needs extra support, extra connection, extra love. So, you know, right now, those boundaries, those disciplines, that is probably not what the kids need as much as they need just more hugs, more connection, more attention. Because the real problem is not that they are testing their limits. The real problem is that they are scared. So it's a different, and parenting is always about, are they testing their limits? Are they pushing boundaries? How am I supposed to respond to that? Versus, do they have a real feeling inside that needs to be attended to? At this particular point in our society, I would bet on they have a real feeling inside, a real emotional need that needs to be attended to. So I hope that helps some of you, because I think it really did help my graduate student. And she did end up, actually, it's been a couple months. This happened at the very beginning of it. And she told me that actually her daughter is sleeping on her own again. It just took a few weeks of kind of providing that extra cuddle. And then she gradually moved away, just stayed there until she was sleepy. And then she stayed, you know, kind of by the door, and then they got to where they needed to be. But that regression is normal, and it's a sign of emotional pain in our children, and we want to respond to that. So what have these poor toddlers and preschoolers been going through? Their whole life changed, seemingly without warning. Their parents are having these huge, big worries. They have their teachers, classrooms, grandparents, whoever, they're separated from them, those other adults that they loved and cared for. Their friends that they miss. You know, particularly around the age of 4, friends become a big deal, and that is very important. And so they really miss that. They don't have any idea of kind of how big the world is, you know. So from our perspective, you know, the world is huge, and, you know, to just lose one place to go, but this was half their world for a lot of these kids. So, or maybe they lost 2/3 of their world. So they have their home world, their school world, and grandparent world, for example. Well, now they're down to 1/3 of that world that they had, and they don't have the perspective to be able to understand that. Another thing that I think is really important is that kids, especially in the toddler preschool age, are gaining a lot of independence and achievement, and that is developmentally what they need to be doing. They are learning how to get dressed. They are learning how to feed themselves. They are learning how to write their name. They're learning these different things, and that gives them a huge sense of self-confidence. Well, now all of a sudden, that's all been taken away. So it's very difficult for them from that sense, because, you know, the school environment, or, you know, grandma and grandpa's house was a place where they could, you know, be a little bit different, try on a new personality, try on new skills. And you don't do that as much at home. So that's, I think, another challenge for our younger kids. So like I said, expect that there's going to be regression. Relax some of the rules. It's okay. And prioritize the connection right now over boundaries, because there's a real emotional pain that needs to be addressed. Okay, so I love this. What we think our kids need during isolation versus what our children actually need during isolation. We think we should be doing, I saw a friend post a really beautiful Pinterest learning activity that she did with her kids. Good for her. I'm glad it worked out. It's not necessary. You know, it's really okay to just give them hugs, to do some simple play, to have them play on their own. That's great. To talk to them, to snuggle them. Like I said, that 15 minutes of special time a day can really make a huge difference in behavior. And to talk about their memories, to talk about their teachers, grandparents, those kinds of things. They don't need new toys. They don't need to be kept away from screens. We're gonna have a whole talk about screens in a little bit. They don't need rigid schedules, and they don't need a lot of academics right now. The learning brain is not on. And so, you know, the fear brain is what's on right now and what's driving things. So it's okay if they don't do all of that schoolwork. And the good news is that 90% of the kids are not making much academic progress either. So, you know, we don't have to worry about how things are going. I actually like, instead of a schedule where you have things broken down by half hour, I like a routine. So that's one thing that you can think about is it doesn't have to be, okay, we are doing, you know, this from this time to this time and this from this time to this time. It's more like we wake up, we get dressed, we have breakfast, we do some schoolwork, we have snack, we do some playtime, we have lunch, more like a flexible thing. And that way you can have a little bit of flexibility and it doesn't feel quite as rigid. Okay, so we talked about labeling feelings. You also want to limit information or make the information age appropriate. Try to have those adult conversations away from these young kids about, you know, who it is that we know who's getting diagnosed, how they're doing. It's different for older kids. Older kids can handle that. But a young child this age, they're not going to understand it. I like the world caught a cold. I think that's a great way of putting it for kids. And there's some great books that we'll talk about that do this. Give them some outlets to express their emotions, whatever that might be for them. If it's trampoline jumping or just, you know, having a jumping contest, if it's running around, if it's doing art, if it's doing music, whatever it is that they need to do, give them an opportunity to express their emotions so they know that those emotions are heard. And you don't have to fix their emotions. You can just say, oh, I can tell that you're feeling really angry. This picture that you drew shows me that you're feeling happy today, or it shows me that you're feeling, you know, you're feeling that you miss your teachers if they drew a picture of the teachers. Focus on connection. Another thing that's great for toddlers and preschoolers, although it might drive us crazy, is chores. There's a magical age when kids learn to do chores. It's called the age of initiation. It goes from about age 3 to about 7. So from 3 to 7, they want to help you with everything, and they're really terrible at it. But after the age of about 7, they don't want to help you anymore. So if there is an opportunity to teach things, this is the opportunity to do it, as painful as it is. And believe me, I know how painful it is to try to fold laundry with a 2-year-old. But this is an opportunity to do things together and to just do the best that you can. Creativity is a really great thing. You know, those outlets to express emotions, let them be creative. And we talked about modeling that emotional resiliency and how important that is. Okay, so here are some of the things that I really like. These are specific resources, and they're going to be available. Carrie is going to send out an email tomorrow that will have some links that will help you out. So cognitive behavioral therapy is a particular group of mental skills that we know works very, very well on anxiety and depressive symptoms. And there's a great online program called Go Zen, which is available. They have a trial basis for like 30 days, but then you can spend $100 or $200 to get it for an entire year. where it's a really wonderful program that I use doing therapy myself all the time, and I have used with my own kids when they have had times that they have been feeling particularly anxious or stressed. And we for sure pulled it out in the beginning of this pandemic and went through some of the resiliency module, and it helped a lot. It really did help my kids a lot. But you don't need to be a psychologist to do it. You can go through and do it with your own kids, and it has these online videos. Now they say that it starts working around age 5, so for some kids they just might be too young for this, but I think you can go down to age 4. So if you guys have got a toddler, probably not as helpful, but a preschooler might be able to take some of those videos. They do some deep breathing techniques. Some of their videos are available, like the one called 4-7-8 breathing is available on YouTube. And that can just be a good way of getting kids to just calm their bodies a little bit. I love the Cosmic Kids Yoga series. They do both yoga and they do mindfulness and they do bedtime stories. And so all of those things are great ways to get kids' energy out, get them a little bit more relaxed. They have a lot available for free on YouTube, but they also have an app which has all of their new content. And I think it's really, really great. It's helped my kids a lot and a lot of the clients that I work with. There's a really great model of the brain. So talking to kids about the brain actually is a way to help them a lot. So there's this flip the lid hand model of the brain where this is your amygdala deep inside, and then these are your frontal lobes. And when kids lose it, when they have a tantrum or lose it behaviorally, we say we're flipping the lid. That means that this guy's in charge, and we really want these guys to be in charge. So who do you want to be in control? You or that deep part of your brain that is telling you to freak out? So there's a bunch of great YouTube links. Here, this is kind of how they do it. It kind of shows you what the brain is, and it teaches, and you can use that as a let's not flip our lid. And teaching kids about the flipping of the lid can really help them understand what they're doing and why. And there's some great videos on YouTube kind of showing how to do that. A couple of online books. So some people put some books immediately online, and some of them are on YouTube. There's one called Time to Come In Bear, which is really nice, which kind of explains to toddlers and preschoolers about what's happening and about social distancing and needing to come inside. And there's another one called Something Strange Happened in My City. And it talks about it from a toddler and child preschooler perspective, which I think is a great thing to read to kids, because we know they do so much social and emotional learning from reading. Also, Daniel Tiger has had some wonderful episodes on the pandemic, and they also have great episodes just on some of those skills that kids need to learn, like washing hands. They do these little songs. Daniel Tiger is really all about social emotional learning. It's one of those programs that really has a lot of research behind it. So does Sesame Street. So certainly, as we're all doing more screen time than normal, those would be things that I would recommend, those two shows. But the little songs in Daniel Tiger really seem to help toddlers get a hang of these behaviors they need to be doing. Elmo and Sesame Street have done a lot of episodes, and there have even been some Grover did a podcast on NPR's Life Kit, where he talks to kids directly about what his experience has been like in the pandemic, what he's spending his time doing. And Grover is supposed to represent that young child. So I think that that's really nice. It's something that kids can relate to and helps them a lot. So this is the hand model of the brain, the flipping the lid, which there's a great video on. Okay, so because we are in this position of having to manage all of this and manage our families, manage our children's emotions during this time, it's a really big job. And so it takes more than the normal self-care skills to kind of get you through that and get you into a place where you can do this. So meditation and prayer have really, really good science behind them in terms of it brings up that frontal lobes and kind of calms down that amygdala. So we know that mindfulness meditation actually causes growth in the frontal lobes. So it's a wonderful, wonderful skill. And there's some evidence that prayer really does a very similar thing. So if you can take those few minutes to do it, many of us can't. I really like the Calm app. I think it's very good. It teaches you how to meditate. They even have a section for kids, probably for older kids, but taking you through that, taking you through the breathing, focusing on your breath. If you can't make the time to do that, one thing that's a really good thing to do, a quick mindfulness exercise, is to take, when you're doing your hand washing, instead of singing a song for 20 seconds, take a moment and kind of feel, how does the water feel on my hands? How does the soap feel? How do my hands feel rubbing together? Take deep breaths during that time and concentrate on that breath for 20 seconds instead. And that, even a 1-minute meditation can do a lot to calm you down so that you're less reactive for your kids. Another technique is called, coaching yourself through a crisis. So one of the things that you can think of is psychological distancing. So instead of saying, I am doing this, I'm doing that, you can actually say, you can refer to yourself by your own name. So Juliana is feeling this way, and I knew that I had to make a decision to act in this way in order to get where I wanted to go. Kind of separating yourself, imagine as if you are your own friend looking at yourself and deciding what it is that you want to do, how you want to behave in that moment, kind of taking a step away from yourself and looking at yourself. That distance actually really helps in terms of making better decisions and calming yourself down a little bit. It takes some of the stress out of the moment, kind of forces you to engage those frontal lobes. Another one that I like is the temporal distancing. So imagine it's 3 months in the future, 6 months in the future, a year in the future. What do you want to look back on this time as having been? Do you want to look back on this time as having been, like, can you say, there were some good things that came out of this? Or I want to look back and say, we all survived, we had dinner together, maybe we played some games, that's the best we could do, or we gained these skills, or we became closer as a family, or we got to spend more time together, or, I potty trained my toddler. Whatever it is that you managed to think of, just think about yourself in the future looking back on this time, and that perspective can really change some things. Another thing that we started to implement in my family comes from the work of Brene Brown, who's a wonderful social worker, who does a lot of research and talks a lot about emotions and bravery and vulnerability. And she says that one thing that she's had to do in her family is what we call a family gap. So kind of make a battery level. So for example, this is draining. This whole situation is draining. So, but there are times that it's different, that we have different energy levels, so we kind of refer to it as a cell phone battery. So maybe one day you're functioning at 15%. You're just not able to be who you want to be. And another day you might be at 80%. So you check in with your older children, with your co-parent, if you're lucky enough to have somebody there with you, and you say, what percentage do I have today? And then how can we support each other? Because there's no rhyme or reason to this. There's going to be times that people are going to need to do a little bit more self-care, take a break, and then they'll be on board when the next person needs that time. So that having that family gap plan, having that be part of the conversation has been, I think, really helpful. For my kids who are 8 and 10, they're a little older, they were able to say to me now, my battery level is just drained. And that's when I've been able to say, and I'm flexible about it, okay, we won't do school today. We'll do reading and we'll practice the piano, and that's all we're going to do for today, and we'll make it up later in the week. If that's the flexibility that you have, that is okay. It's really okay to do part of that. We've talked about making emotions part of the conversations among adults. I think it's really important that we just all talk about these things and be responsive to them, and that models it really, really well for kids. And then for me, like I said, I like the Calm app, and I've also gotten a lot of good support out of, there's a podcast called the Happiness Lab, and the Happiness Lab is really interesting. It is a course that was being taught at Yale on the science of happiness, and they decided to offer it, and so many kids signed up that they had to move it into the auditorium where they have concerts. Okay, so it became the most popular course at Yale, had about 1,000 students in it, if you can believe it. And then she started recording all of them, and they became on YouTube, and then she turned it into a podcast. So she actually, it's very much it's for the parents, not for the kids at all. But it's really a great resource in terms of talking about like different ways to cope through this, little different tips. One tip that I got from her name is Dr. Lori Santos, by the way. So Dr. Santos, one of the tips that she got was, you know, there's kind of this thing that you can do when you have a moment and you're transitioning between things, and you just might get on your phone and just scroll social media or check the news or check Twitter. And one thing that she said is, instead of doing that, she takes that moment when she's feeling a little bored and doesn't quite want to move on to the next task, and she uses that opportunity to text a friend or call a friend. And that has been very helpful for me. And I think that she said she found that to be a really good tip, just to kind of maintain that connection when it's so hard to maintain connection nowadays. Also, this is for us because we're impacting our kids. Focus on the things that you can control versus the things that you can't control. We cannot control how long this is going to go on. We can't control if other people are wearing a mask or social distancing. We can't predict what's going to happen. We can control yourself. You can control having compassion for yourself and others, the activities that you want to do. Change your focus to that as much as you can. It's a hard thing to do, but it's good. Okay, screen time. What everyone's been waiting for, I'm sure. So I know one piece of medical advice I won't be following in these times, and it's the American Academy of Pediatrics guidelines on screen time. Yes, absolutely. We cannot be following that limit of, what is it, 1 hour a day for, I mean, you know, it's very, very limited, especially if you are working. This is just not going to happen. My hope for you is that your child will pay attention to a television and be able to sit through it long enough that you can get some work done, if that's the case. But it's okay. So basically, good news for all of us, the American Academy of Pediatrics understands the situation you're in and is putting on different guidelines. So instead of just blowing it out of the water, let's talk about how to do it. Okay, so this is what they're saying for older kids. They're saying make sure, and remember those older kids are doing a lot of their work on a computer, right? They're saying try to spend 4 hours a day off screens. I think that's a reasonable goal for the toddler preschool set, especially if a parent is working, okay? You want another thing to think of: no screens at meals, no screens in bedrooms or bathrooms. I think those are reasonable for preschoolers as well. And monitor that content. So sure, it's absolutely fine to watch Disney movies. It's absolutely, you know what the good screens are. But try to have something that provides some social emotional lessons in there as much as you can. Basically, make sure the kids still get exercise every day. Kids this age need 1 to 2 hours of exercise a day. Do your best to get them that. It will make everyone happier. It will make them sleep better. It will, you know, and it will make their emotions better. But make sure that the screens are not interfering with relationships, which is why I try not to have them at mealtime, and make sure that they don't interfere with sleep, which is why to make sure they get some exercise and don't bring them into the bedrooms or bathrooms. I think that's pretty reasonable. If the screen is your babysitter all day while you're working, that is okay. Just try to protect those meal times and make sure there's still some exercise time. And also probably, you know, the blue light from the screens can interfere with your brain's ability to make melatonin. So it's a good thing to kind of not have it too close to bedtime. If it interferes with your child's sleep, if it doesn't, and that's what they do to wind down, that's fine. Try to make a little bit of time every day for families, activities, and connectedness. And it can just be a little bit of time, okay? It really can be that 15 minutes. If you're trying to work and homeschool and all of that, 15 minutes has a profound effect, believe it or not. And then try to start the day strong and finish the day strong. And, you know, have a good morning routine, have a good bedtime routine. And if they're watching TV all in between, except for meals, that's okay. You know, we all are doing the best that we can. I hope that that makes sense about the screen time. So kind of in summary, understand what trauma looks like and how this is happening in your child's brain and why this is so difficult for both you and your children. Let the feelings happen. It's okay to be sad, you know, to have a day where you're just lying on the couch because you're feeling sad and everybody's snuggling. That is absolutely fine right now. But just spend some time talking about that. Another thing to do is to kind of find out what they know and correct any misinformation that they might have in their head. Because oftentimes you think that they don't know what's going on, but they actually know just a little bit of it and they filled the rest of it in with something awful. And that's very common that they behave that way. What are their worries? Are they realistic? What can you talk about? Focusing on what you can control in your own life, in your own household versus what's outside as much as you can, because your job is bigger. Your job is, working and parenting and teaching and doing all of these things. What helps your child feel safe and bring them a lot of that? We actually, even for my 10-year-old, we pulled out, those loveys have been kind of stuck in the closet for, I don't know, a good year, 2 years. And one day when he was just feeling really off, I pulled them out of the closet and gave them to him. And it was like I had given him big giant thing of Skittles. He was so happy. So even though they might not realize they need it, you might realize that, going back to some of those comforting things that you had when you were younger can really be helpful. And stock up on your compassion and resilience techniques for both yourself and for your child. And then that direct teaching of coping skills, directly teaching the flip the lid model, directly teaching some prayer or mindfulness meditation. Another thing to do, this is a mindfulness strategy, is called a 5-4-3-2-1. And so this can kind of get your kid out of a tantrum or out of getting worked up. And so you say, what are 5 things that I can see? What are 4 things that I can hear? 3 things that I can touch? 2 things that I can smell? And 1 thing that I can taste? And kind of grounding them in their senses can really help kind of bring some of that in. So those are some of the coping skills. All right. So despite all of this, this is still going to be really messy. Even when you're doing the best you can, we may still fall short of what we would like to be able to do, but life isn't perfect on any front. And doing what we can with what we have is the most we should expect of ourselves or anyone else. So when I say we got to lower the expectations, I do mean it. We have to. We're doing the best we can. Mr. Rogers said so. So recently, Dr. Kessler, who worked with Kubler-Ross, who developed the stages of grief, got permission from her family to add a 6th stage of grief, meaning. So that is one thing that I can say that I hope that we all get out of this at the end, is that maybe we'll find some meaning in all of this. Not just acceptance of the loss, but maybe find a way to say, this is what this experience has taught me. This is what I hope to get out of this. This is how I hope our family might be different, or our society might be different. Maybe we're less focused on so much academic pressure and whose kid was the first one to be reading all their sight words, because maybe we're focused more on kindness than on and compassion and resiliency than we are on those kinds of little academic skills. I want you guys to have some resources because we do know that therapy really can help. It really helps reduce symptoms of anxiety and depression. Certainly in kids, we would want to do therapy before we would move to medication. I don't prescribe medication. It can be very helpful for a lot of kids who are suffering anxiety, depression, but I always, unless there is a self-harm situation or a really serious situation, certainly therapy we know is just as effective, and the effects can actually last longer because it teaches you these mental strategies. Early intervention is absolutely key. You can go to a family therapist, a licensed mental health counselor, a licensed psychologist. Play therapy, I think, is really good when it comes to a trauma. So if your child has had a traumatic event, I think play therapy really helps them express those feelings. But if you're dealing with more behavior, you really want to probably work with a family counselor, particularly a licensed psychologist, because psychologists are experts at changing behavior. And so if that's where your concern is, that would be my advice. Where to find a person? That's always the challenging part. Asking your pediatrician or your hematologist actually would be your first bet. You will be surprised how many hematologists actually have, particularly if they're major children's hospitals, there's somebody working on staff who accepts insurance, understands your medical needs, but is not just there to deal with medical needs, but is also there to deal with regular anxiety and stress that is happening. The pediatrician might just know good people in your community who come highly recommended. They don't necessarily have that medical background of a pediatric psychologist, but they can still get you what you need. And there's a psychologist locator as well. Anytime, if you're ever concerned, a lot of people don't know this, If you are ever concerned about self-harm, that you actually can call 911 or bring someone to the ER. So that is actually what to do if that's ever a concern. Hopefully that's not something anyone is dealing with, but if it is, that's what to do about it. But you know, a lot of families are going to need some extra support in order to get through this difficult time. There's really the prolonged effects of this are going to be pretty big on mental health. And so basically, if that amygdala turns on and we never get it turned off, that's going to lead to a lot of disorders, a lot of struggles, and a lot of pain. And so, but if we work on it now, you know, before it's ingrained in these thought patterns, then that can really be helpful. And I think that's the end. So see if anybody has any questions.
Thanks, Dr. Bloom. If you would just give me a moment, I'm going to upgrade everyone to panelists. You won't get disconnected. I just wanted to let you know that before I do that, you'll see some weird things on your screen, but just hang tight, and that will allow for us to open up for conversations and to interact a little more with Dr. Bloom. And also, if you choose to show your video, you can feel free to. It's not required, of course. All right.
Can you see that, Carrie, or you want me to read the question?
Go ahead. Yeah, you can read it.
Okay, Dr. Bloom, it says, fabulous presentation, thank you. As the parent of a toddler, I feel bad that he is often alone in his playpen while my husband and I are on our computers and calls. We always make time in the evening to be with him. Should we be concerned about him being on his own in his playpen so much during the day?
No, I mean, you have to do what you have to do in order to keep food coming into the table and keep a roof over your heads. And actually learning how to play on his own is a really great skill for him to have. So of course it's not ideal. I mean, I understand that, but like I said, as long as you give him that special time, and as long as you give him that opportunity to move his body, then I think that it's really just fine. And it's what you have to do in order to get through this time. But if it makes you feel better, learning how to play on your own is a really, really important skill that a lot of kids don't develop in today's very fast-paced, moving world. And it really ends up having some negative mental health consequences for them. So it's absolutely fine as long as he's happy. Believe me, toddlers will let you know when they're unhappy. So if he's not screaming, then I think that you're doing a great job. And even if he is screaming sometimes, that's okay too.
I believe everyone has the ability to unmute yourselves. If you'd like to type a question into the Q&A, feel free to, into the chat box. Or if you should have the ability to unmute. If there's some sort of technological glitch we're unaware of, I apologize. But feel free. Does anyone have any other questions for Dr. Bloom before we wrap up this evening? We have just a comment in the chat box. I don't know if you can see that, but it says, thank you so much for the presentation. It helped me a lot. I second that, as I'm living this as well. Lots of positive, excellent presentation. Thank you, Dr. Bloom.
Good, I'm so glad. I hope that we can spread the word that how difficult this time is and how normal that is. I think we'll all just feel a little less alone.
Absolutely. Oh, we have a question. Is it a problem for young kids to see their parents on their phones, or kids to be on phones for prolonged periods?
my major concern is the phone going to get damaged? That's, for the really young kids. No, I mean, virtual interactions are absolutely fine. I mean, even way before this, one of the criticisms of the whole don't watch too much TV thing that pediatricians were saying is, obviously FaceTiming with grandparents is a very different kind of thing. Kids don't completely understand, depends on the age, changes completely from the time a child is, say, a young toddler to the time a child is 4 or 5. But they have a hard time understanding the difference between, Elmo, who they can see on the television screen, versus grandma, who they can see, and understanding when they can interact and when it's just a show for them to watch. But that's part of the reason why really good preschool age television is so it leaves space for them to talk back to the screen. It's still building social skills. And certainly right now, what I would do as much of it as you can in terms of talking to a parent on the screen, talking to a grandparent or cousins or whoever, friends, I would do as much of it as the kids are willing to do, because they're not getting those chance to build those social skills. So I think it's completely fine. I mean, it's never going to be as good as doing it in person, but it's a lot of the way there. So I would encourage it. I definitely don't think there's any harm to it.
What about for young kids to see their parents on their computers for a prolonged period?
Oh, for the kids to be seeing their parents constantly interacting with a screen, they're going to imitate you. But what choice do we have? I mean, there's not really a choice here. You've got to get your work done. And this is part of life. They're going to be seeing that. They're going to imitate. So you might expect them to start imitating that behavior. But as long as you give them, that time when you're being responsive, when you're being warm, when you're making eye contact, when you're doing some time following their lead, they're going to end up fine. It's really a matter of, try to have that special time. And that's really going to be something that will kind of counteract that, seeing them interacting with screens constantly. But it's okay to set a boundary. I mean, I would make it clear. I would have the time when you're engaging, and then I would say, okay, Daddy's got to go to work. I'm going to be on my computer now, and I won't be able to play with you for a little while. And make those boundaries clear so that the child understands. I mean, they might not follow them, but the best that they can to understand that this is a signal saying we're transitioning to a different way of being. Not just, your child, you've been playing with your child, don't just walk away and get on your computer. I mean, if that happens, sometimes it's fine, but, trying to set those boundaries up so the kid understands the best they can.
Great, thank you. Any other questions for Dr. Bloom?
There's another question in the chat here. It says, my just turned 5-year-old has been experiencing a sleep regression. He tries to sleep on his own, but then will wind up in our bed in the middle of the night. Just before Easter, he witnessed our neighbor's house catch on fire.
Oh.
Seems fine during the day and has played fireman or firefighter and doesn't seem to talk much about it anymore. After listening to you, I'm wondering if his sleep regression is in addition to COVID. Am I overthinking this?
Probably not. It sounds like your child, I wouldn't say it was a traumatic event seeing the neighbor's house catch on fire, but it was certainly an upsetting event. And it's certainly normal for then a child to say, could that happen to us? And to have fears about that, and to be acting that out in play, and possibly having nightmares about that. And to need a little reassurance from family for a while. So I think that they're probably related. I think that you want to make sure that you're getting your sleep. Okay, that's really important. But it's also okay to do, particularly when things are really tough like this, to do a little bit more snuggling with your child around sleep. Or if it doesn't bother you, if they're waking up in the middle of the night and ending up in your bed and it's not disturbing anybody's sleep, I think it's fine, and it'll probably go away. It'll probably either go away or it'll start happening earlier and earlier, in which case you'll deal with, you probably don't want it to be happening to interfere with their going to sleep and you having a little bit of time on your own. So one of the two will happen. It'll kind of just fade, or it'll get worse and then you can deal with it. But if it's not bothering you, I think it's fine.
And we have another question come in. What if you have children with different ages in the same household? How much time do you give a 1-year-old, a 4-year-old, and a 10-year-old?
To be honest, I think the 15 minutes if you can. So that's times 3, so that's kind of hard. The 10-year-old can probably handle it not happening on a daily basis, but I would probably try to do it, once every other day if you can. You're absolutely right. The needs are very, very different. A 1-year-old needs to connect with you a lot more than a 4-year-old does. And the 4-year-old needs to connect with you a lot more than a 10-year-old does. But they do all need to connect with you. The great thing is that they can also connect with each other. So as much as you can encourage that happening, I think that's really, really helpful. But if you can try to make it to that 15 minutes a day with each of them, or sometimes all together, if it's happening peacefully and people are feeling good, I think that would be ideal. I'm sure you know all these things. You can have the 10-year-old read to the 1-year-old or the 4-year-old, or, try to do these things. But they all need some time. They all need some of that direct connection. But I think it feels a little bit more manageable when you're thinking about, okay, I've got to do this for 45 minutes and fit that into the day, as opposed to, I need to do this, I wish I could be spending every minute of my time paying attention to my children, but I still have to work. Is that helpful?
Yes, very much so. And peacefully in my house has been the motto recently, with a 10-year-old and a 5-year-old, you just never know, right? Any other questions for Dr. Bloom?
We've had an epidemic of fighting over here too. And, it always upsets me because, especially like my kids are supposed to know better, right? They don't. They have no idea, and they're still working through the same things that all siblings are working through. And, we do the best we can, but sometimes we just have to take a break from one another, and that's absolutely fine. And we did that recently. One parent took the 10-year-old one place, one parent, different parts of the house, just kept them separate pretty much for an entire evening. And that actually really helped. Mm-hmm. So, you can try those kinds of different things. They don't have their space from each other that they're used to having.
Exactly. Yeah. They're not used to this much together time.
No, they're not.
Mm-hmm. Okay, well, I'd like to thank you all for your participation and time this evening. I just want to remind you that we do have the next webinar in the series, A Whole New World, Parenting in a Pandemic, will be next Thursday, May 21st at 7 p.m. Eastern. This focus for this one will be on parenting that school-age child. So we hope that you have learned a lot tonight and are able to share the information about this series with other parents who could perhaps find support during these uncertain times. So once again, I'd like to thank Dr. Bloom for that very insightful and helpful presentation. And just as a reminder that this session was recorded, as will all of our parenting webinars, and we will post them on HFA's social media outlets and also on our YouTube channel for future reference. If you have any questions, please don't hesitate to contact us at hfaprograms@hemophiliafed.org. Thanks again, Dr. Bloom, and I hope you all have a wonderful evening.
Thank you for having me. It was a pleasure to be here.
Thanks. It was a pleasure to have you. Have a good evening, everyone.